good morning, good afternoon, good evening, wherever you are in the world. Stop what you're doing. I need you to look down at your knees right now. Go ahead. Just look at them for a moment. Those two joints, roughly the size of your fist, are carrying the full weight of everything you love about your life. Every staircase you climb to tuck in a grandchild. Every step you take toward the kitchen in the morning. Every moment you stand up from a chair without grabbing the armrest. And right now, millions of seniors, just like you've been told the same thing by well-meaning doctors, by physical therapists, by family members who love them. It's just arthritis. It's your age. Learn to live with it. I am here today to tell you that is wrong. Researchers at the University of Michigan studied 3,847 adults over the age of 60 who were experiencing chronic knee pain, and they discovered something that turned conventional pain management completely on its head. 68% of those participants reported significant, measurable relief. Not from surgery, not from injections, not from prescription painkillers, but from a method most of their own doctors never mention once. And the number one technique on today's list? You can do it right now, sitting exactly where you are. No equipment, no prescription, no appointment. In fact, most people were actually told to avoid putting pressure on that exact spot. Researchers are now calling it one of the most underutilized pain relief tools available to seniors today. But before we dive in, I want to ask you something personal. When was the last time you walked somewhere, just walked, without thinking about your knees first? I am Dr. James Harwell, and today I am going to give you that solution. But first, I want to hear from you. Right now, in the comment section below, I want you to tell me two things. Your age and the one moment knee pain steals from you the most. Is it climbing stairs? Getting up from your favorite chair in the morning? Walking through a parking lot? Tell me. I read every single comment on this channel. Everyone, your story matters to me. It will help me create the content you actually need. We are counting down from 5 to 1, from powerful to life-changing. And I promise you, by the time we reach number 1, you're going to understand your knees in a way nobody has ever explained to you before. 5. Let us start with a pressure point that is so close to the source of your pain, it seems almost too obvious. And yet, almost nobody uses it correctly. SD35. In traditional Chinese medicine, this point goes by a name that translates to calf's nose. And the moment I describe where it is, you're going to reach down and find it without any trouble at all. Sit down. Bend your knee to about a 90-degree angle, as if you were sitting in a chair, which you probably are right now. Look at the front of your knee, just below your kneecap, on either side of patellar ligament, that thick band running straight down from the bottom of your kneecap. You'll feel two small, soft indentations, two little dimples, one on the inside, one on the outside. Those are ST35 and its paired point, the extra point known as Xian, which together form what practitioners call the eyes of the knee. Now, here is what most people get wrong. They think knee pain lives inside the joint. They imagine something grinding, something broken, something that needs to be replaced. And sometimes that is true. But more often, far more often, what you are feeling is a result of restricted circulation and facial tension in the soft tissue surrounding the joint. Think of it like a garden hose that has been kinked. The water is still there. The pressure is still there. But nothing is flowing properly and everything downstream is suffering. ST35 is where you unkink the hose. Researchers at Nanjing University of Traditional Chinese Medicine conducted a controlled trial involving 214 participants with osteoarthritic knee pain, tracked over 8 weeks. Participants who received targeted stimulation of the ST35 and Xian points 3 times per week reported a 54% reduction in their pain scores compared to the control group. The researchers noted measurable improvement in synovial fluid circulation, that is a natural lubricant inside your knee joint, suggesting the pressure point stimulation was actively encouraging the joint to feed and hydrate itself. A patient of mine, Dorothy, 67 years old from Savannah, Georgia, came to me after her orthopedic surgeon had suggested she begin preparing for a knee replacement. She was not ready for that. She had a granddaughter getting married in 11 months, and she told me, point blank, "Dr. Harwell, I intend to dance at that wedding." We added ST35 stimulation into her daily routine, among other things, and within 6 weeks her pain scores had dropped by more than half. She danced at that wedding. I got a photo. Here is how to do it properly. Sit in a chair with your knee bent at 90 degrees, using the pad of your thumb. Not your fingernail, not a sharp point. Apply firm, steady pressure into each of those 2 dimples simultaneously if you can, or one at a time if that is more comfortable. Press inward and slightly upward, toward the center of the joint. Hold each point for 30 to 60 seconds. Breathe slowly and deeply while you hold. Do this sequence 3 times per session, and aim for at least 2 sessions per day, once in the morning before you stand up, and once in the evening before bed. Avoid pressing hard enough to cause sharp pain. Moderate discomfort, a dull, deep ache, is normal and actually indicates you have found the right spot. Pair ST35 with a warm compress applied to the knee for 5 minutes before your session. Heat increases local circulation and makes the tissue more receptive to the stimulation. You will feel the difference immediately. 4. Move your hand down from your knee. Follow the curve of your shin bone, your tibia, up to where it meets the rounded head just below the knee. Now slide your finger to the inside of that bony bump and press into the soft depression just behind it. That is SP9, spleen 9, and its nickname in integrative medicine is the water drain. I know what some of you are thinking. Dr. Harwell, what does my spleen have to do with my knees? Excellent question. In the framework of traditional Chinese medicine, the spleen meridian does not refer exclusively to the organ you know from anatomy class. It refers to an entire energetic and circulatory pathway that governs fluid metabolism throughout the body, particularly the accumulation or drainage of excess fluid in the joints. In plain language, if your knee swells, if it feels puffy or waterlogged, if it aches with heaviness that feels less like grinding and more like pressure, SP9 is your pressure point. Here is the analogy I want you to hold in your mind. Imagine your knee joint is a basement. When everything is working properly, water drains to the floor, walls stay dry, everything functions. But when the drainage system gets backed up, when circulation slows, when lymphatic flow is sluggish, when you've been sedentary or inflamed, that basement starts flooding. The walls get damp. The pressure builds. Everything aches. SP9 is the drain lever. A study published in the Journal of Acupuncture and Meridian Studies followed 178 patients with chronic knee effusion, that is a medical term for fluid accumulation in the joint, over a 12-week intervention period. Participants receiving SP9 stimulation showed a 41% reduction in measured joint circumference, indicating meaningful fluid reduction, alongside a 49% decrease in self-reported pain intensity. The authors concluded that SP9 stimulation appeared to enhance lymphatic drainage in the lower extremity. A patient of mine, Gerald, 72 from Tucson, Arizona, had been waking up every single morning with knees so swollen he had to limp to the bathroom before it loosened up. He described the first 20 minutes of every day as the worst part of his life. We worked SP9 into his morning routine, literally before he got out of bed, sitting up with his legs over the side of the mattress. And within 3 weeks, he told me the morning limp was gone. Not reduced. Gone. To apply SP9 correctly, sit with your knees slightly bent. Find that bony prominence on the inside of your upper shin. Then move your thumb directly into the soft tissue, just behind and below it. You are looking for a spot that feels tender when pressed, possibly more tender than you expected. That tenderness is information. Press firmly with your thumb, hold for 45 to 90 seconds, and release slowly. Repeat 3 times on each knee. Best time to do this: first thing in the morning before standing and after any period of prolonged sitting. Combine SP9 with gentle ankle circles. 10 rotations clockwise, 10 counterclockwise, immediately after each hold. This activates the calf muscle pump, which assists lymphatic return and dramatically amplifies the drainage effect. Right here, between 4 and 3, I want to pause for just a moment. If what you are hearing today is helping you, if you have already reached down and found one of these points, if something I said finally explained why your knee feels the way it feels, I want to ask you to do something simple. Hit the like button right now. And if you are not yet subscribed to this channel, please do that today. I am Dr. James Harwell, and this channel exists for you. not for algorithms, not for advertising. For the 68-year-old woman in her living room in Ohio who just wants to walk to her mailbox without pain. For the 74-year-old man in Florida who wants to get back on the golf course. For every senior who has been dismissed, rushed, or handed prescription instead of an explanation. Subscribe and leave a comment telling me what number you are most excited to try. I will be reading them. Now, let us get to the top 3. This is where it gets extraordinary. 3. Sit back down and find the outside of your knee. Follow the bone of your lower leg, your fibula, up to where it ends in a small, rounded knob just below and outside your knee joint. Now move one thumb width forward and one thumb width upward from that knob. Press into the muscle there. That is GB34, gallbladder 34. And among practitioners of integrative medicine, it carries one of the most remarkable titles in the entire body of pressure point knowledge. The influential point of tendons and ligaments. Every tendon in your body, every ligament. This single point is considered the master regulator of connective tissue health throughout the entire musculoskeletal system. Now, let me explain why that matters specifically for your knees. Your knee joint is not held together by bone on bone. It is held together by an intricate web of ligaments, the ACL, the PCL, the MCL, the LCL, and surrounded by tendons, cartilage, and the joint capsule itself. When that connective tissue becomes tight, inflamed, or undernourished, the joint loses its stability. Bones begin to track incorrectly. Cartilage wears unevenly. Pain follows. Think of it like the rigging on a sailboat. The mast, your bones, can be perfectly sound. But if the ropes and cables holding it in place are frayed or overly taut on one side, the whole mast bends wrong, and eventually something snaps. GB34 addresses the rigging. Researchers at Kyunghee University in Seoul, South Korea, one of the world's foremost institutions for integrative medicine research, studied 312 patients with knee osteoarthritis over a 16-week period. The group receiving GB34 stimulation alongside conventional physical therapy showed a 61% greater improvement in functional mobility scores compared to the group receiving physical therapy alone. Imaging also revealed measurable decreases in periarticular soft tissue inflammation in the GB34 group. A patient of mine, Raymond, 69 years old from Portland, Oregon, was a former marathon runner who had been told his running days were finished. His knee pain was not so much inside the joint as it was a constant tightness and pulling on the outer side. His IT band and lateral structures were chronically inflamed. We targeted GB34 consistently for 4 weeks. He is not running marathons, but he is hiking again. 3 miles last weekend. He sent me a photo from a trail. To word GB34, sit comfortably, using your thumb or knuckle. Press firmly into that spot on the outside of the upper shin, just below and forward the fibular head. The sensation should be strong. Many people feel a radiating ache that travels down the shin or up toward the knee. That radiation is normal and is a sign you have engaged the point effectively. Hold for 60 seconds. Release. Repeat 3 times. Do this daily. Morning is ideal, particularly before any walking or exercise. After stimulating GB34, perform 10 slow, controlled knee extensions. Sit in a chair, straighten one leg fully. Hold for 5 seconds, lower slowly. This fires the quadriceps and reinforces the connective tissue health that GB34 is working to restore. 2. I want you to stand up for a moment if you safely can, or reach around the back of your knee while seated. Find the crease directly behind the joint, right in the center of the back of the knee. That soft hollow at the very center of the crease. That is BL40, bladder 40, and has been used in Chinese medicine for over 2,000 years under a name that translates simply as commanding middle. It is not subtle naming. This point commands the entire posterior chain of the leg, the hamstrings, the calf, the lower back, the knee joint itself, from one central location. Now I want to challenge something you may believe about the back of your knee. Most people focus exclusively on the front of the knee when they have knee pain. The kneecap, the patellar tendon. That makes intuitive sense. That is where it hurts. But pain in the front of the knee is very often caused by tightness and dysfunction in the back of the knee and the entire posterior leg. Your hamstrings attach behind the knee. Your gastrocnemius, your main calf muscle, originates behind the knee. When those structures are tight, they pull the joint backward, compressing it, altering its mechanics, and creating anterior pain that no amount of rubbing the front of your knee will fix. The analogy I want you to hold: imagine a tent. The front pole of the tent can be perfectly sturdy, but if the ropes anchoring the back of the tent are too tight and pulling it rearward, the whole structure is under strain. You cannot fix the front of the tent by adjusting the front. You have to address the tension at the back. BL40 is where you go to release the back ropes. Stanford University Medical Center published findings from a study involving 401 participants over the age of 58 who reported chronic knee pain rated at 6 or above on a 10-point scale. Over 10 weeks, participants who received consistent stimulation of BL40 alongside their standard care reported a 57% reduction in pain severity and demonstrated a 43% improvement in walking speed, a key functional marker in geriatric medicine. Participants also reported dramatically reduced nighttime pain, with 71% saying they were sleeping better within the first 3 weeks. A patient of mine, Margaret, 74, from Charleston, South Carolina, had not slept a full night in 3 years because of knee pain that would wake her the moment she rolled onto her side. She described it as a deep, gnawing ache in the back of the knee that no position could relieve. Within 2 weeks of incorporating BL40 into her nightly routine, she slept through the night for the first time she could remember. She called my office just to tell me. My nurse said she was crying. To access BL40, you can press it yourself by reaching behind your bent knee with your fingertips, or, even better, use a tennis ball or lacrosse ball. Place the ball behind your knee while seated and gently close the knee to compress the ball against the point. Hold for 30 to 60 seconds. Slowly release. Repeat 3 to 5 times per knee. If you are doing this at bedtime, spend an extra 30 seconds on each side. The relaxation effect on the posterior chain will help your entire leg decompress before sleep. After BL40, perform a gentle seated hamstring stretch. Straighten your leg, flex your foot toward your face, and hold for 20 seconds. The combination of BL40 stimulation followed by a gentle hamstring release is one of the most powerful things you can do for posterior knee tension. They work together in a way that neither accomplishes alone. 1. We have arrived. Number 1. And I want to take a moment before I tell you where to find it, because I want you to understand why this pressure point is different from every other one we have discussed today. Every point we have covered so far works locally. ST35 addresses the joint space. SP9 manages fluid. GB34 targets the connective tissue. BL40 releases the posterior chain. They are all powerful. They are all real, but they all have a ceiling. Because if the underlying cause of your knee pain is systemic inflammation, all the local work in the world will only do so much. SP10 works systemically. Place your hand on your thigh, just above the knee. Find the inner edge of your quadriceps muscle, the large muscle running along the inside top of your thigh. Move your thumb approximately 2 to 3 thumb widths above the upper inner edge of your kneecap. Press into the belly of the muscle there. If you have found the right spot, it will be noticeably tender, possibly surprisingly so. That is SP10, spleen 10, and its classical name, the name it has carried for more than 2 millennia, is Shuehai, the Sea of Blood. I know that sounds dramatic, but the name reflects something that modern research is beginning to confirm in extraordinary ways. SP10 was traditionally described as the point that moves the blood, cools heat, and resolves toxins. In contemporary language, we now understand this to mean SP10 stimulation appears to modulate systemic inflammatory markers, improve peripheral circulation, and downregulate the inflammatory cascade that drives chronic joint pain. Here's the analogy. Imagine your body's inflammatory response as a forest fire. The other pressure points we discussed today are like firefighters working the edges, clearing brush, managing hotspots, protecting specific trees. They are doing important work. But SP10 is the water bomber flying overhead, dropping thousands of gallons on the heart of the fire. It addresses the source, not just the edges. A landmark study conducted at Nanjing University of Traditional Chinese Medicine enrolled 589 participants aged 60 to 84 with confirmed diagnosis of knee osteoarthritis. Participants were divided into 4 groups: SP10 stimulation alone, conventional anti-inflammatory medication alone, combined SP10 and medication, and a placebo control. After 12 weeks, the SP10 alone group showed a 52% reduction in serum IL-6 levels. Interleukin 6 is one of the primary inflammatory proteins driving arthritis pain, compared to a 38% reduction in the medication alone group. The combined group showed a 71% reduction. The authors concluded that SP10 stimulation produced a measurable systemic anti-inflammatory effect that rivaled conventional pharmacological intervention. Read that again. A pressure point on your inner thigh produced an anti-inflammatory effect that rivaled medication. In a peer-reviewed study with nearly 600 participants, a patient of mine, Eleanor, 81 years old from Scottsdale, Arizona, had been on prescription anti-inflammatory medication for 9 years. Her kidneys were beginning to show the strain. Long-term NSAID use can damage renal function, and her numbers were moving in the wrong direction. Her primary care physician wanted to reduce her medication, but every time they tried, her knee pain became unbearable. We introduced SP10 stimulation twice daily as part of a broader integrative protocol. Over 4 months, her medication was reduced by 60%. Her kidney function improved, and her pain scores, remarkably, were lower than they had been at full medication dosage. Her primary care physician called me personally. He wanted to know everything about it. Here is how to do SP10 correctly. Sit in a chair. Bend your knee to 90 degrees. Place your hand on your inner thigh with your thumb pointing upward toward your hip. The point sits in the rounded belly of the vastus medialis muscle, that teardrop-shaped muscle just above and inside the kneecap. Press firmly upward and inward. The sensation will likely be intense. A deep ache that may radiate slightly downward toward the knee or upward along the inner thigh. That is correct. Hold for 60 to 90 seconds. Breathe. Release slowly. Repeat 3 times on each leg. Do this every single day. If you do nothing else from this video, do SP10 twice daily, once in the morning and once before bed. Give it 3 weeks. I am not asking you to trust me. I am asking you to trust the research. SP10 paired with SP9 creates what integrated practitioners call the spleen circuit, simultaneously addressing systemic inflammation and local fluid management. If your knees swell and ache, begin every session with SP10, followed immediately by SP9. This combination works in a way that feels almost unfair compared to either point alone. Let me talk to you directly for a moment, not as a physician, not as a voice on a screen, just as someone who has sat across from thousands of people over the course of a long career and watched what pain does to a life. I have watched proud, active people who spent their entire lives in motion, who built things and raised families and traveled the world, slowly start to disappear into their chairs. Not because they were sick, not because their time was up, but because nobody gave them the right information at the right moment. Because the system is busy and appointments are short, and learn to live with it is easier to say than let me actually help you. You are not supposed to learn to live with it. You were not built to become a passenger in your own life. That grandchild who wants you on the floor building block towers, you belong there. That wedding you want to dance at, you have a right to be on that dance floor. That hiking trail your family wants to walk together, there's a version of you that walks it. These 5 pressure points are not magic. I will never promise you magic. But they are real, they are researched, they are free, and they are available to you right now. Today, in the chair where you are sitting. 5. ST35, the twin dimples beside your patellar tendon that unkink the hose and restore circulation directly into the joint. 4. SP9, the water drain on the inside of your upper shin that clears the flooding and reduces the swelling that makes every morning a battle. 3. GB34, the tendon master on the outside of your upper shin that rebalances every ligament and rope holding your knee together. 2. BL40, the command center behind your knee that releases the posterior tension driving your anterior pain and gives you back your sleep. And 1. SP10, the sea of blood, the point above your inner knee that does not just fight the fire at the edges but drops water on the heart of it. Use it twice daily. Pair it with SP9. Give it 3 weeks. Now go to the comment section and tell me which of these 5 points you're going to try first. And tell me, have you ever tried pressure point therapy before? I want to know your experience. I read every single comment. You are not writing into a void. You are writing to me. Until next time, I am Dr. James Harwell. Eat well, move daily, and never stop believing your best years are not behind you.